Hi everyone, this is Robin Tofill. Thank you for viewing this presentation. Before we get started, I would like to acknowledge the MIS team and thank them for their hard work and contribution in the implementation of OAAPS requirements. The SUA and I personally appreciate their participation in this process and recognize that being a part of this project was especially challenging given their demanding schedules. Again, thank you. In this presentation, we will define OAAPS, review some changes that will occur in the 2022 SPR workbook, discuss changes in consumer demographics, and look specifically at services associated with programs impacted by OAAPS. Let's first discuss OAAPS. OAAPS refers to the Older Americans Act Performance System. This is a new system that states will use to submit the state performance report. With the use of this new system, ACL has revised some of its SPR reporting requirements. These new requirements are sometimes referred to as OAAPS requirements. So the reporting system and requirements are being used interchangeably by the term OAAPS. It is important to note that OAAPS is independent from WellSky Aging and Disability. AAAs will continue to report SPR-related data in A&D. Some of the new reporting requirements do not require any action on our part. We will continue to record data in the same way we always have, and A&D will perform the necessary actions behind the scenes to meet ACL requirements. Other requirements, however, will necessitate changes in how we report and in our administrative structure within A&D. New OAAPS reporting requirements go into effect on October 1, 2021. The first SPR data that will be submitted through OAAPS will be fiscal year 2022. There are a few OAAPS changes that will impact the SPR workbook. Remember, these changes are for fiscal year 2022, so they will not apply to the workbooks that you will receive in the next week or so, which reports on fiscal year 2021. Nevertheless, I want to review these changes so you are prepared to collect the necessary data that will be requested in 2022. Network funding is a new data element under OAAPS. It gives ACL a picture of other federal funds that are used to deliver services reported in the SPR. ACL is interested in whether Medicaid, Medicaid waiver, SSBG, CSBG, USDA, or DOT funds are used specifically, and more generally, if other federal funds are used to deliver services. We already capture some of these funding sources in the SPR workbook. If any of these sources are reported in the Other Federal Sources or Other Sources columns of the SPR workbook, they will need to be specified. The AAA staff profile has also changed in OAAPS. We no longer need to report personnel categories by functional responsibility, clerical and support staff, or minority employees. There are new data elements that we must report, however, such as the number of full and part-time staff employed at each agency. Full-time staff are employed 35 hours or more per week, whereas part-time staff are employed less than 35 hours. Staff that are paid in positions as of September 30th of the report year are counted in the SPR agency staff profile. Also new is reporting the number of AAA staff employed through CSEP. These staff are hired by the AAA, not staff who manage or oversee the CSEP program. CSEP beneficiaries are included in the counts of full and part-time staff. We must continue to report on the number of volunteers at each AAA, but we now must also report on the number of hours these individuals volunteered. These hours will be reported aggregately in the SPR workbook. There are also ways to record this information in A&D if any agency is interested, but it is not required. If anyone is interested in pursuing this, please reach out to me. Most changes associated with consumers' demographics do not require additional action by staff. A&D will make the necessary modifications behind the scenes. I want you to be familiar with these changes, however, so you know how data is reported in the SPR, and in case you may want to use the same distributions when reporting to board members and other groups. There are two poverty categories in OAAPS. One is new and reports on consumers above poverty. The other changes the below poverty category to at or below poverty. These data elements automatically populate based on what is recorded for income in the A&D assessment form. It is still very important to record the in poverty field in the A&D assessment form, since this is how the system maps data to these two poverty categories. Household status retains lives alone as a data element. It also adds a new element for lives with others, and for legal services providers, adds lives in long-term care facilities. These data elements automatically populate based on what is recorded for living arrangements in the A&D assessment form. Consumers' ADLs and IADLs are currently reported as scores of 0, 1, 2, and 3 or more. OAAPS combines the 0 and 1 scores into one category. OAAPS reports consumers with 0 to 1, 2, and 3 or more ADLs or IADLs. These categories automatically populate based on what is recorded in the ADL and IADL scales in the A&D assessment form. Some ADL and IADL activities have changed in OAAPS. Activities of daily living in OAAPS are eating, dressing, bathing, toileting, transferring, and continence. OAAPS adds continence and removes walking as an ADL. The Form 5 and A&D assessment form have been adjusted accordingly. IADLs in OAAPS are using the telephone, shopping, preparing food, housekeeping, doing laundry, using transportation, managing medications, and handling finances. OAAPS combines heavy and light housekeeping into one housekeeping activity and adds laundry as an IADL. The Form 5 and A&D assessment form have been modified to include these IADLs. OAAPS changed the age distributions that are reported for non-caregivers. It breaks out the 60 to 74 age group into two categories, 60 to 64 and 65 to 74. A 65 and older count is helpful for data analysis since certain census tables use this age category for providing data. These age categories are populated automatically based on the date of birth that is entered in A&D's consumer record. The SPR considers consumer age to be an individual's age as of the last day of the reported fiscal year. For caregivers of older adults, OAAPS also split the 60 to 74 age group into two categories. In addition, caregivers under the age of 60 are divided into two age groups, 18 to 49 and 50 to 59. Age distributions are automatically populated based on the date of birth recorded in the caregiver's consumer record. For relative caregivers of children, the 55 to 74 age category is now divided into three age groups. They are 55 to 59, 60 to 64, and 65 to 74. Prior to OAAPS, how states define rural was left to their discretion. Connecticut used census data to determine rural status. In OAAPS, ACL has defined the method for designating rural areas. Rural is defined by RUCA codes. This was done largely because FIPS, or Federal Information Process System codes, have been discontinued. RUCA stands for Rural, Urban, Commuting Areas and are based on zip codes. The use of RUCA codes has eliminated many previously defined rural areas in Connecticut. We now only have about 10 rural designations statewide. Connecticut is not alone. Other states have also experienced reductions in rural areas. In Maine, for example, the areas around Bangor are not considered rural under RUCA. If anyone has been to this area, it is hard to understand how this region isn't rural. WellSky has provided a one-time assignment of RUCA designations in A&D. Moving forward, states are required to update these codes as they change. A&D will show two rural designations in the consumer record. They are RUCA is rural and FIPS is rural. The FIPS is rural field is the old rural designation based on census data. RUCA is rural is the new rural designation in OAAPS. Beginning October 1, the RUCA is rural field is the field from which rural designations will be pulled for federal reporting. At some point, we will likely remove the FIPS is rural field from the consumer record. We thought during the OAAPS transition period, agencies that experience changes in rural status may want to see where these changes occurred. Some of you may be pleased with the changes in racial categories. Under OAAPS, non-minority white non-Hispanic and white Hispanic are combined as one data element, which is white. All other racial categories remain the same. Another important change for race is that consumers can identify with and report more than one race category. This has reporting implications since the total number of consumers by racial category is now a duplicated count and should be recognized as such when generating reports. The Connecticut Registration Form and Connecticut Assessment Form in A&D have been updated to include white as a race selection. Non-minority white Hispanic and white Hispanic are no longer race options for Connecticut. WellSky, however, has retained the use of non-minority white non-Hispanic and white Hispanic in A&D. Both data elements will map to white for federal reporting. You will continue to see these data elements in the ethnic race section of the consumer details. Because Connecticut records race in its assessment form, this shouldn't be an issue for recording. I wanted to bring it to your attention, however, so you are not confused when you see these fields in the consumer details. When white is recorded in the Connecticut assessment form, it will map to non-minority white non-Hispanic in the consumer details, and ultimately to white in OAAPS. There are new data elements that group consumers into minority and non-minority categories under OAAPS. These categories automatically populate based on what is entered for ethnic race. The total from these categories produce an unduplicated count of consumers. Gender in OAAPS is defined as one's inner sense of one's own gender. OAAPS has added other as a gender selection. Connecticut has also added non-binary as a gender option. Non-binary is automatically populated to other for federal reporting. A&D's consumer record will show two gender-related data elements, gender and gender identity. Gender is the old pre-OAAPS data element and will be removed from the consumer details shortly after October 1. Gender identity is the new gender field in OAAPS that will map to the SPR. Starting October 1, it is very important that you record all gender-related data to gender identity. WellSky generated a script that mapped responses from the old gender question to the new gender identity data element. While these two data elements are illustrated in A&D, it is extremely important to always record to gender identity. Gender and gender identity are separate data fields, and what is applied to gender will not populate the gender identity field. Now, let's look at how OAAPS has impacted specific programs. Outside of the demographic changes we just discussed, there are only a few changes associated with Title IIIB. The unit for daycare changed from 1 hour to 1 day for federal reporting. Since hours can be converted to a day or a portion of a day, WellSky is retaining the 1-hour unit and making the necessary adjustment for federal reporting. As a result, Connecticut is also retaining the 1-hour unit. Case management service definition is also revised. The unit for nursing visits has changed from a 1/4 hour to 1 hour with the ability to record in partial hours. Legal services has new requirements that will be discussed later in this presentation. SPR services reported as other services are reported by service groups or domains. These groups will be mapped by the SUA and requires no action on behalf of users. Changes in health promotion services in OAAPS are intended to help ACL better understand all the services that are delivered by the health promotion program, including non-evidence-based services. OAAPS requires that in addition to reporting on evidence-based health promotion services, we report on non-evidence-based services. As you know, Title 3D can only fund evidence-based services. We currently have a subservice in A&D to identify health promotion services that are evidence-based. A non-evidence-based subservice has been added to all health promotion services to accommodate the new reporting requirements for non-evidence-based activities. As of October 1, a subservice must be recorded for all health promotion service deliveries. There are several changes related to nutrition services and nutrition risk. Nutritional risk is now reported in two categories. In addition to reporting consumers with nutritional risk scores of 6 or more, we must report on those with scores of 5 or less. These categories automatically populate based on responses recorded for the nutritional risk scale in the A&D assessment form. The unit for nutrition assessment has changed from a person session to 1 hour. The definition for nutrition counseling has been updated to include language that cites improving nutritional status with a measurable goal. The unit for congregate and home nutrition education has changed from a person session to 1 session. And there are other acceptable ways in which nutrition education can be delivered, aside from in person. Nutrition education can be counted when it is delivered in person, virtually, and in certain cases, when hard copy materials are provided. The ways in which sessions are presented are required to be reported as well. A nutrition education session is recorded differently from how we generally record sessions for other programs. A session refers to the topic discussed during a nutrition education presentation. These topics, or sessions, are only counted 1 time, regardless of how many times they are delivered and how many different formats are used to provide them. For example, if a presentation on heart disease and cholesterol is presented 20 times at 20 different cafes, this presentation would be considered 1 session because it is the same topic or presentation. Likewise, if this topic was delivered in person 10 times and through Zoom 10 times, it would only be considered 1 session, regardless of how it was presented. Nutrition education sessions and the way in which they are delivered are reported aggregately. Consumers that receive nutrition education in person, by telephone, or virtually are registered in A&D, and a unit of either congregate or home nutrition education is applied to the consumer. Consumers that receive nutrition education through a newsletter or with hard copy materials are reported aggregately with an estimated audience size. The count of nutrition education sessions or topics and the count of consumers that receive nutrition education are 2 separate counts that are not directly related. The SUA established a new service called Nutrition Education Topics to record the new way in which nutrition education sessions are reported. This service is reported aggregately and includes how the nutrition topic is presented. The SUA will capture the number of people that receive nutrition education by the consumers that receive congregate and home nutrition education units and by the estimated audience size of people that receive hard copy materials and newsletters. Nutrition education sessions will be captured by the new service, Nutrition Education Topics. The National Family Caregiver Support Program is one of the programs that has been impacted most significantly by OAAPS. There are changes in relationships, age distributions, which we already discussed under consumer demographic changes, service definitions, and service units. OAAPS added several new relationships for caregivers of older adults. They are domestic partner, which includes civil unions, sister, and brother. We have had these relationships in A&D for some time. They have now been added to the updated consumer registration form. OAAPS has also added parents as a relationship for older relative caregivers of children. This is displayed in A&D and on the updated consumer registration form as mother and father. The other elderly relative and elderly non-relative relationships have been removed in OAAPS. Instead, older relative caregivers record to other relative and non-relative. Other relative and non-relative relationships are now shared by caregivers of older adults and older relative caregivers. This is a very important change that adds to the importance of collecting and recording complete care recipient data in A&D, including the care recipient's date of birth and linking the care recipient in the caregiver service delivery. These actions are critical for data to be mapped correctly in the SPR. Caregiver counseling, support groups, and training are reported as separate services in OAAPS and no longer combined into one category. This means that consumers and units, unit costs, and missing data associated with each of these services will now be much more obvious to ACL during their SPR review and may generate additional questions. We must be mindful of this and ensure that service and expenditure data associated with each of these services are complete and accurate to limit such questions. Again, it is important that full care recipient data is collected and recorded, which includes date of birth, the correct caregiver relationship, and the care recipient's association in the caregiver service delivery. This will ensure data is mapped correctly to the SPR. Caregiver counseling remains a registered service in OAAPS. There is a new definition for caregiver counseling. Counselors must now be degreed or credentialed professionals licensed by the state of Connecticut. Activities recorded under caregiver counseling in fiscal year 2021 are recorded as information and assistance in OAAPS. The unit of caregiver counseling has also changed from a person session to 1 hour. Caregiver support groups also has a new definition which specifies who can provide this service. The unit has changed from a person session to a session. I think many of you will be pleased to hear that ACL has changed caregiver support groups to a non-registered service. This means that data is reported aggregately. 2 new services have been developed for caregiver support groups. Caregiver Support Groups Monthly records consumers and units for the report month. Caregiver Support Group Year to Date records year-to-date totals as of the report month. These services will be reported aggregately each month by provider. The definition for caregiver training has been updated, but the changes are not as significant as the caregiver support group and caregiver counseling changes. The unit for caregiver training has changed from a person session to 1 hour. Caregiver training is still a registered service and recorded in A&D. Respite services are now broken out into 4 different types: in-home respite, out-of-home respite day, out-of-home respite overnight, and other. In-home respite includes all respite services provided to the care recipient or caregiver in the home, including live-in services such as live-in home health aide and live-in personal care worker. Out-of-home respite day includes respite services provided in settings outside of the caregiver's or care recipient's home and where an overnight stay does not occur, such as daycare or day camps for children. Out-of-home respite overnight includes respite services provided to care recipients in residential settings where the care recipient resides in a facility temporarily for a full 24-hour period. This would include overnight summer camps and temporary inpatient care. Other respite includes respite services that are delivered and do not fit into the services we just reviewed. At this time, Connecticut does not have any services in this category. A service category has been created in A&D for each type of respite. New services have also been created to accommodate these new respite categories. It is important to review the updated service definitions document to identify these new services. Supplemental services and OAAPS are reported as domains. Domains group similar supplemental services into categories. The domains are assistive technology, durable equipment, emergency response, consumable supplies, home modification and repairs, legal and/or financial consultation, homemaker, chore, personal care, transportation, nutrition services, and other. A new service category has been created in A&D for each supplemental domain. The old A&D service category for supplemental services, called National Family Caregiver Support Program Supplemental, will be end-dated. Users do not have to take additional action to record services to service categories. When a service is applied to a consumer's service delivery record, A&D automatically populates the correct service category. Domains have required many supplemental services and their subservices to change in A&D. In order to keep services and their associated subservices under one domain, some subservices under OAAPS are associated with a new or different service. Please review the service definitions document carefully when applying supplemental services to ensure you are recording accurately. Case management, as well as information and assistance, also have updated service definitions. They are no longer reported as a group within the access category. Both services are reported separately in OAAPS SPR. We will continue to record these services as we always have. By reporting these services separately, their associated discrepancies, unit costs, and missing data will be easily exposed in the SPR. We want to be mindful of this and be sure recorded data is accurate and complete to limit questions from ACL. A new service called Public Information Services has also been created, and this, for the most part, is what we previously referred to as public education. ACL wants to better understand and enhance its ability to tell the story of legal assistance activities that are funded by the Older Americans Act. As a result, OAAPS has established new data elements for reporting legal services. ACL has been in conversations with legal services providers during the development of OAAPS and is not asking for any data that is not already collected by providers for representation purposes. In OAAPS, legal services under Title IIIB is a restricted service, which means all demographic and consumer characteristics are reported in aggregate. All data must be de-identified. Personal identifiable information on legal services consumers is only recorded at the legal provider level and is not shared. This means we no longer record Title IIIB legal data by individual IDs and associate IDs with Form 5 information. Title IIIB legal services will be reported in A&D aggregately. Legal services providers will continue to report on hours of legal assistance, as well as on newly established services. The new data elements legal services providers must report on are open cases, closed cases by type, closed cases by level of service, such as advice, limited representation, or representation, and on client demographics and characteristics. Again, all data is reported aggregately to the AAA. Definitions for each of these services are included in the revised service definitions document under a separate legal services section. Legal services providers are aware of these definitions and reporting requirements. They have been working with ACL as well as the SUA, MIS team, and some other AAAs. The SUA, MIS team, and certain AAAs help design the reports that legal services providers will submit to AAAs. AAAs will receive monthly reports from legal services providers. These reports will provide data for the report month as well as year-to-date totals. In addition to data that is required for OAAPS, these reports include data requested by the MIS team to help AAAs monitor legal services in their regions. This data includes a town report showing the towns in which legal services were provided, as well as a report of open cases by case type. Data associated with these reports are not entered into A&D. New legal services have been created in A&D. Each new data element has two associated services. One service records units for the report month. The other records a year-to-date total as of the report period. The SUA will establish an aggregate consumer for each legal services provider, similar to consumers created for eligible no ID meal participants and Alzheimer's AIDS. All aggregate data reported by the legal services provider are applied to this one consumer. The SUA will extract this data from A&D for the SPR. There is a difference, at least for now, in how legal services are recorded for Title IIIB and for the National Family Caregiver Support Program. As we just learned, legal services under Title IIIB is a restricted service, which must be recorded aggregately. Under National Family, however, legal services is a registered service. This means the way legal services under Title IIIB is recorded has changed, whereas under National Family, it has not changed. Continue to record legal services delivered by the National Family Caregiver Support Program in the same manner you did prior to OAAPS, as a supplemental service. I want to spend a few minutes explaining what you will see in Aging and Disability as we transition to OAAPS and the documentation you will be provided. As you can see, there are significant changes associated with OAAPS. Some services are associated with different A&D service categories. Subservices may be recorded to different services. Some services have different units of measure, and some have new service definitions. The SUA and MIS team established a protocol to help users with OAAPS changes and to help them distinguish between new OAAPS services and old services that will be end-dated, especially during the transition period when users might be entering 2021 and 2022 data simultaneously. In keeping with past practices, we tried, to the best extent possible, to limit the creation of new service and subservice names. We generally change the service name that is being retired to limit the learning curve for staff when service changes occur. You will see some services and subservices in A&D with an extension of 9/30/21. These are services that are impacted by OAAPS and will be retired at the end of the fiscal year. You will not be able to add service deliveries to these services if service dates are after September 30th, 2021. You may, however, see these services in drop-down menus. If you are generating reports on fiscal year 21 data, you will want to use services with the 9/30/21 extension. As of October 1, you will also see services and subservices with a 10/1/21 extension. These are services associated with new OAAPS requirements and should be recorded to as of October 1. As we transition, the extension on these services will be removed. If a service was not impacted by OAAPS, it will not have a date extension and is recorded in Aging and Disability as it has always been. AAAs will receive an updated consumer registration form electronically, which includes all new OAAPS data elements. This will be followed by 2 separate deliveries of hard copy forms. The service definitions document has also been revised and will be forwarded to AAAs. This document will include a section that lists services by program to help staff become familiar with new service structures. This is especially helpful for the National Family Caregiver Support Program. As we discussed, there are many changes to this program. This section may help to identify the service and its associated attributes more quickly. Caregiver and MIS staff will receive revised caregiver administrative charts as well. There were substantial changes made to the system and new protocols developed to comply with OAAPS. The SUA and MIS team did its best making these changes. Moving forward, we may find that some protocols require tweaking. I'm asking for your understanding and patience in advance should this happen. I am very hopeful it won't. If you have questions on what has been presented, please email me the question at the address shown on the screen. Most of you already know my email address. Please use the subject OAAPS Presentation Questions. The SUA will answer the questions it receives and will forward responses in one document to all AAAs, regardless of whether they asked a question. This will help ensure that everyone receives the same message. If the question is a program-related question, the appropriate program person will answer the question and it will be added to the response document. I again want to thank you in advance for your patience as we work together through these new requirements. As always, if you are not sure on how to record data, or if you are not seeing something in aging and disability that you think you should, please do not hesitate to reach out to me. Thank you for attending this presentation and happy reporting.